call the meeting to order. Any items from the public? All right, if not, I need a motion to approve the agenda.
Mr. President, I move to modify the agenda under the consent agenda to table till next week the hiring of
Kim yours.
And
Okay.
with that modification, I move to approve the agenda.
All right, motion's been made and seconded. Any discussion on the motion? If not, all in favor say aye.
Aye.
Anyone opposed? The motion carries. Purchase order. Anybody have any questions on the purchase order?
Doesn't take long for that to build up real quick after you take a week off.
You think Tracy would have been gone somewhere? All right. There's no internal budget revisions.
What? No internal budget?
Little bit too early for that, huh?
Next week.
There is some change in status. The new hire recommendation received from the Honorable Sheriff Curtis Keller for Ginger Sabel
Full time.
as an animal control officer with an annual salary of $26,030 effective July 6, 2020. I'd say that is full-time, yes.
Yeah.
Salary increase received from Alan Davis, County Administrator, for the following firefighters for 10 years of service. Thomas Newcomb, Daniel Petrie, increased from $48,764 to $50,227 effective July 1st, 2020. Martin Roberts increased from $59,021 to $60,791 effective July 17th, 2020. Any questions on those? Need the approval minutes. I was not present for June 18th, 2020.
Second.
Have a motion on the floor and a second. Any discussion on the motion? If not, all in favor say aye.
Aye.
Anyone opposed? Let the record show that I abstained from that vote. County council calendars, they will be closed down other than public safety and necessary offices for tomorrow to recognize the 4th of July Independence Day. We'll be back in the chamber at 9:30 a.m. On Thursday the 9th. We boards and commissions, they have the ambulance authority, which was postponed and rescheduled for tonight at 5 p.m. here in the chamber. Yeah, might not be in the chamber. I don't think it is. Monday, the 6th at 6 p.m. Planning Commission. Tuesday, 5 p.m. Sewer District, 6 p.m. Stormwater District. Wednesday, the 8th at 9:30 a.m. Development Authority. 4 p.m. Telemon, 6 p.m. Brown House Authority. Thursday, the 9th, 6:30 p.m. at the Fire Board here in the chamber. Any corrections on the boards and commissions?
Mr. President, I believe the townhouse could be following the fact that that's too many people's out of town.
Okay. Well, we have any other changes?
President, let me point out that on Saturday, August 2nd, we have our surplus property.
Do we? Okay.
We have obtained quotes and we're auctioning for us. And we're really planning on doing it this spring, but we take it before
All right.
in the parking lot, mostly vehicles, some office chairs, a little bit of miscellaneous equipment left over. We moved facilities out of 520. We have Coach Street filed at level 1 and no not a lot. We are looking at somehow including the equipment 9 to 5 or 750 all motion.
Those air compressors.
Air compressors.
Yeah, which are massive.
Three-phase. Three-phase.
They're three-phase, but I mean, they're rotaries.
You contact other agencies,
I guarantee
like
you,
the health department,
big ones.
water board, sewer board, like that. Would it be appropriate?
Takes a lot of time to do, a lot of time and effort.
You know, it wouldn't be our responsibility other than sell it, but, you know, they wanna haul it over too.
Yeah, I think the vehicles, Jim, I think vehicles and equipment like that's fine. If they wanna, you know, I mean, I think it would be a good idea because it's only gonna attract more people. It's the small stuff that has to be staged outside, then if it rains and all that stuff, that's the only thing. But I don't have a problem with it, but I think it's probably gonna be too short for this one.
No, I agree. This is too late, but I think maybe in the future,
Yeah,
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 may not be much, but every little bit helps.
Sure.
To get through life.
yeah. And,
Also be asking.
right, we kind of put that on back burner. Yeah. Yeah, we got a lot going on right now. Let's put on an agenda for it to, like, 1st of August or something. All right. Anything else? All right, we have a bond release for Chandler's Glen Phase 2, file number 060-04. Lots 1 through 65 and lots 156 through 253. The engineering department has made that recommendation. That's a lot of lots, Dirk. That's a lot. That's a lot of lots. And then the grading bond release for Chandler's Glen Phase 2, plan change lots covered 1 through 65 and 156 through 253. Engineering department has made that recommendation. Grading bond release from Banbury Holdings LLC, the Lakes of Martinsburg, Phase 3, $86,268. Phase 4, $105,000. And Phase 3, $280,000. Engineering department has made that recommendation. And then on the last one was a bond reduction from Rott's Family Limited Partnership Overlook at the Riverside, Phase 2, final plat, lots 14 through 20. They are a huge amount of dirt.
It's unbelievable.
117 through 126, 134 through 141, and 164 through 177. Any changes or questions for Dirk on those? Need a motion to approve the consent agenda.
Second.
All right, got a motion on the floor, a second, any discussion? If not, all in favor say aye.
Aye.
Anyone opposed? The motion carries. Nothing from the assessor's office. Board meeting reports, Mr. Barnhart.
Thank you, Mr. President. I did have a home consortium meeting, of course, it was a Zoom meeting, but me and Bill Clark were here at the Computer Central, and everybody else was zooming in. And I tell you, it's like talking to the wall, you know.
It is.
Sometimes you get a response, sometimes you don't.
Kind of hard to get a feel, get a read on the audience.
Yeah, yeah. You know, I'm not sure who's there and who isn't, who comes in, who leaves.
Who's putting going on mute and talking to somebody else and doing their business?
So we had, charter funds will be frozen, Habitat for Humanity, for Trudeau and all the other actors. But pretty much a routine meeting, and I won't go there. But I was there.
All right.
And I zoomed them, and I survived it.
We're gonna get you a license plate, new license plate for your truck, zoom. All right, Ms. Mott.
I didn't have regular meetings, however, I had a short meeting with the Library Association, and only more, it was setting up the hours for this week, because it's a short week, and then the regular schedule starts the following Monday. But however, I did work with Keith Hammersley and Seamus Sullivan. We're working on things for the 250th, and one of the things I'm working on, working with Chad and going on the website to put in some history. We're working on getting all of the county commissioners. I've gotten them from 1877 to 1940 now. I've got another couple hours to go in and finish pulling them. So, we can have the website up and running. We'll have all the officers and everything. I hope to have all that done for our 22.
Good.
So,
County clerks and circuit
Yes.
clerks and all that.
all that stuff, yes.
We're gonna incorporate, so one of the things I'd like to, maybe next time they do it is the, caverns in Martinsburg. Think of me when that happens, I'd love to check that out one day.
Up underneath, Adam Stevens. Oh, yeah, all of this, all of
That's
this,
the house above it.
oh, yeah, that's on King Street. Yeah, I've been in that one too, on East King. The
Yeah.
house, it goes onto the tracks, comes up there.
Yeah.
Yeah, there's a lot of, as we say, it's like the octopus. You got a lot of angles. On the other side, I had an individual call me about the fireworks, and she said, "Are the fireworks people handing out flyers, letting everybody know there's only certain days you're supposed to be putting off fireworks, or the fact that you're supposed to have it done in a decent hour?" And I told her I would check the ordinance, but the ordinance doesn't have anything. I know originally there was something where they were handing stuff out originally when we approved the project, but it's not in the regular ordinance. So she said, "Well, somebody just please tell them." But on the other side, you do call the police. My brother lives on Albert Street, and the neighbor called the police about somebody on Albert Street putting off fireworks, and the city dispatcher said that was in the county. So there's a confusion where the county and the city is, and all
Well,
these
maybe
things.
because, maybe they were referring that the county is the one that has the firework ordinance.
That's City of Martinsburg.
City
does.
It does too.
Oh, they do, yeah, City of Martinsburg has one too. So I just said that
It's more restrictive.
it's even more restrictive than the county, so, I just thought I would, say something, bring that up, that there's people, and I know a number of folks that are, upset because, fireworks now seems to be, since people can't get out and do things, they're setting up fireworks. So, wanted to bring that to our attention. And I have for your perusal, the obituary of Kevin Sari, and the gentleman was world renowned, and he was involved in the United States point of view for 18 summers and the archaeological digs in Africa and Italy, including Pompeii and the Roman Forum. And he also did a lot of embassies as far as rebuilding them and new embassies and all these major New Delhi and Pakistan, all those places. Plus, he did the Union Station and everything else, and did renovation. So the gentleman had tremendous credentials and a tremendous personality, and you would have never known that this was his credentials. Because he was just a nice guy, came to the house. His favorite sandwich was, he loved the country bacon. I used to get the sides of bacon and cut it, and he liked that kind of bacon.
All right.
That was his favorite, so, just a great gentleman.
All right,
So, thank you.
Mr. Whitaker.
I did not have any meetings, but however, it was on the radio, WEPM,
Friday.
Good.
That's right.
Good.
talked about current events and the progression of Clorox, and mentioned a little bit about the birthday party. We're going to try to work towards celebrating the airport's anniversary of our birthday of 100 years in 2023.
Very exciting, and airport's doing some wonderful work. So all my boards and commissions got canceled, so I have nothing to report on right now. We have some applications that have would like to be interviewed for some of the boards and commissions. Anybody have any issues about having them to come in?
No.
All right, Penny, you want to schedule them up, please? You got Jay Jack, you got Douglas Long, and Christopher Cox. All right. Guess trying to get over Brian or something like connect.
Mr. President, we can.
Yep, okay,
That is not a public hearing.
all right. All right, Mr. Bentley, you want to come up? It's a consideration and approval of order authorizing the construction, renovation, improvement, furnishings, and equipment for the property owned Berkeley County for the new day report center on 520.
This order that you have before you has two exhibits. One, the lease agreement, and two, the bond purchase agreement. They're typical of what we've seen in every bond that we've dealt with before. This order authorizes the council to enter into a lease with the building commission for the rehabbing of 520 South Raleigh Street for amount of rent equal to the bond payments. It authorizes you to enter into a bond purchase agreement with Cruz and Associates. It authorizes the president and the clerk and directs those officers to execute and deliver the lease, which is Exhibit A, with changes, insertions, and omissions as are approved by the president. It authorizes the president to authorize for delivery and execution the bond purchase agreement, changes as he sees necessary. Authorizes the president, the clerk, and other officers of council to direct and execute and deliver such agreements and other documents as they deem necessary and help. It authorizes the clerk to attest the documents. It also ratifies your approval of this order, ratifies all previous actions of the clerk, president, and other officers with regard to this bond issue. It approves the designation of the bonds as qualified tax exempt obligations, which, as you know, has an effect on our $10 million limitations. It approves the president and other officers, authorizes them to take all such other actions as they may deem necessary and appropriate in doing the bond transaction. So I ask that you approve this order and authorize all those things that I've just talked to you about. If there are any questions, I'd be glad to respond to them.
Just a statement, it looks like the pre-construction meeting is happening next Friday. So, good thing.
We have had the first and second public hearings for the bond issuance. Hearing for that also.
Okay. All right, we need a motion to approve the document, I guess.
Mr. President, I move we approve the order written by the legal counsel and that it be ratified with their signatures agreed to the authority to sign for the council.
All right, motion's been made and seconded. Any discussion on the motion? If not, all in favor say aye. Aye. Anyone opposed? The motion carries.
Thank you, Mr. President.
Thank you, sir. Bring Brian Costello, Director, Berkeley County Emergency Ambulance.
We haven't scheduled any board vacancies.
Okay, all right, you're right. Anybody want to do any board vacancies?
I don't know. Never know if Jim wants.
Okay, all right. All right, Brian. Sorry about that, sir. Give us an update on the NERMs and the changes in West Virginia State EMS code.
Hopefully I'll bring a little bit of good news, but first of all, thanks for having me in today. That currently has nothing to do with COVID, but we'll talk about that later, I'm sure. But what I wanted to come to you today is effective June 4th of 2020, some changes have occurred to State Code 64 CSR 48, which is the state legislation that governs EMS agencies. One of the key changes for this governing body is there's no longer a requirement for the state to have regional boards, such as NERMs. As a matter of fact, all regional boards throughout the state, other than NERMs, have collapsed due to financial instability. NERMs did have a windfall of cash when we purchased 82 Sioux Court, and they've continued to do really good things with that money to provide training opportunities throughout the Eastern Panhandle to the 8 county participants.
So they're still in existence for disbursements of the money and helping out the region. So
Correct. We're functioning.
No other source of income?
There's no source of income. The only source they had then was the rental of 82 Sioux Court at that time. And when the TSN organization lost the contract with state OEMS, they lost their ability to generate revenues. So they were very gracious. We were very lucky, and we were able to purchase that
it's
facility to help.
another one of them great fits.
It did. It was timing, and everything came at the right time.
And that's worked out very well because that building's being used for your field staff, and the
Yes.
new building right next door is being used for operationals of 9/7.
It is. We owned that property next door prior to that happening.
For about 15 years, Brian.
Yeah, and then we were able to reduce the footprint of what we wanted to build by using the 3,300 square foot in that building, which allowed us to build on the property we already owned. So of course that made the construction project much less to the citizens and so forth and so on. So it was just timing.
That was part of my beginning term on the ambulance.
Yeah.
And we purchased those, and we were there for the dedication of that NERMS building. It was quite an event that day.
Yeah, you an old timer with the ambulance authority, weren't you?
Yeah. Oh gosh, yeah.
Started off young on your political career.
Back in 99, I believe.
Yeah.
So, moving forward, what NERMS has chosen to do is to continue to function, to provide training opportunities, and I'll give you a few of those here in a minute. Under their articles of incorporation, there's about 14 pieces in there that really talk about these groups of 8 counties coming together quarterly to do positive things for the region. My take is I don't believe that the agency, because it's no longer legislatively pushed, has a right to impose upon you to solicit volunteers, interview, and appoint to a committee, pretty much. So what they've done is change their bylaws to say, okay, if you have a county agency, such as the Ambulance Authority or the City of Martinsburg, that would want to send representation to these meetings to discuss things and bring stuff forward, that's how they want to operate. They no longer want to put that burden on the county councils or commissions to have to go through that process. So I totally leave that up to this governing
Basically
body.
just pulling together the meeting of the minds.
Pretty much it's what it is. They said, hey, Ambulance Authority, we'd like you to send a rep. City of Martinsburg, we'd like you to send a rep from Berkeley County. If a private person would want to send someone such as PTS or Ryan Neal, they're certainly eligible to do that. We meet quarterly up in Romney, and we just discuss how we push through agendas through this MPCC, which is a Medical Policy and Care Committee. And they've kind of consolidated the regional stuff into a group called MSAC, which is Emergency Medical Services Activity Council. So those two governing bodies really talk to that state medical
I
director.
guess the main goal is to make sure that we're all functioning on the same cylinders then.
It is, and to push up change, push it from the bottom up. So it's been working for the last 2 years. This has kind of been that trial period to see if we could function that way. And it's been doing fairly good from my perspective. We had a year that we didn't meet due to COVID and other issues. So we just had our first meeting a few weeks ago to go over some of these things. But hopefully that's good news to Tracy. But other than that, as I said, we talked about the things that NERMS is doing. They're They're continuing to sponsor their Townsend Scholarship.
So, Mr. Bentley and Anthony, I guess we have to dissolve our membership from NERMS, right?
That is correct. And by doing that, you would have two options. Option A is to, let us continue to participate on a voluntary basis. Or the county could opt out as a whole and then request that 1/8 of any assets be brought back to Berkeley County, which that 1/8% would be around $36,000. Because currently they're holding about $301,000 in investments and cash
So they
position.
want to dissolve the cash of one disbursement, I mean, multiple disbursements, but one at one time.
Well, if the other 7 counties choose to stay in the program, then we would be allocated 1/8 because there's 8 participating
Okay. All right,
counties.
so, okay, for
So-
future.
If down the road we decide, hey, let's just pull out, it's not functioning, it's not working to benefit anybody, then yes, that's what we would do.
All right. Well, I'd probably say, ask you to get with Mr. Davis and Anthony and figure out what we want to do and go from there.
Okay.
We'll come.
But like I said, they're still continuing to use their stuff in the Townsend Scholarship, which is where they, put in $1,000 a year into a student that wants to get into EMS and things like that. We're conducting multiple safety trainings, simulation trainings. You have active shooters on the sheriff's and law enforcement side. We also have active shooter stuff on the EMS side. They've committed over $5,000 of total cost for which Berkeley County has 30 students. Berkeley County would have at least 5 seats in that class, totally paid for. I did mention the EMS safety course, and these are things that we discuss quarterly. What do we want to do? Bringing instructors in, national certified instructors and different things to come in and teach. And we open that up to folks as well.
So it sounds like to me you support the direction that they're going.
Yeah, the direction they're going now, I fully support, but we know how these things can take a turn to the left very quickly. So at this time, I would suggest that we continue to participate in some form or fashion.
Okay.
Do they need any kind of staff?
They do not have any staff. This board is all volunteer now. When TSN existed, they had a director and a staff member. But there's no staff as far as we go. It's like any other voluntary board. You have a chairman, secretary, and it's all done based on your volunteer time. But subject to any questions that you guys will have, I'll get out of the way and wait for the COVID brief.
No, I mean, I over the years since you've taken the director's position, I've had full confidence in your job that you do, and I'll say it here as I always do. I have full confidence in your direction that you want to go in.
Thank you so much. Appreciate it.
Mr.
Yeah.
President, Bill Kearns is on a regional health report. Zoom meeting. He was not here to provide a COVID-19 update. He would like to pass along that the health department is actively working for grant writing, maximize amount of CARE Act funding.
And
Brian would probably.
okay, all right. Well, we'll take Miss Petrie since she's here now, and then we'll bring Brian back up.
That way you
I don't know if I heard correctly from the Senate Finance, Charleston, that can get up to $200 million of reimbursement from that billion. So,
Well, it's $1.25 billion for state, so
yeah, so
it's
a region, county's
60 or
eligible.
60 or 40% of it or something like that comes back to the county.
Yeah, so
It's 60-some million.
it was up to 200 something million for all 50. For all 55, okay.
Yeah, it'd be $600-some million for the counties, I think, or something. Good morning, Miss Petrie. How you doing?
Good morning. I'm good. How are you doing?
I'm doing wonderful. You have 43 as state accounts for the month of July. Is
That's-
that correct?
That is correct.
Glad you're slowing down.
Uh-huh.
That's good. I don't think that's at her discretion, though. I don't think she controls that.
No,
So,
No.
things were slowed down as far as being able to get in the courthouse and all this other stuff, but it doesn't appear that the number of people knocking on your door.
it does not. We have a waiting
on the door.
line, quite a bit.
Yeah.
That's funny.
Okay, let's get started here. The first estate I have to present is Joseph T. Andrews, also known as Joseph Tyrone Andrews, Joseph Paul Arata, Louise Virginia Barrett, Benjamin Franklin Bartles, Jeffrey G. Burcham, James R. Chapman, Lois Evelyn Conrad, Wilma L. Cooper, Jules Alfred Couder, Roger Van Delosier, Dean Marcus Domenico, Joy Bobinger Erme, also known as Joy Losa Erme, Elizabeth Ann Fellers, also known as Elizabeth A. Fellers, Leon Foreman, David Lee Fowler, Anthony Wayne Gales, Walter L. Hess, Edward Darrell Hogbin Sr., Samuel Eugene Huff, Mary Wanda Keller, Jerry E. Keefe, Diane A. Henderson Kilby, also known as Diane A. Henderson, and Diane Agnes Kilby, Betty Jane Conser, also known as Betty J. Conser, John Gregory Conser, Effie Marie McKee Mong, also known as Effie Marie Mong, Cheryl Alvin Mongan, John Franklin Murphy, Carolyn Palmer, John Sherman Pappas, Alice Francis Piasecki, also known as Alice Piasecki, Geraldine L. Price, also known as Geraldine Price, Lawrence Henry Price, David Radkowski, Avenel P. Reel, Anna P. Rockwell, Harry Ernest Rogers, Mary L. Rogers, Margaret M. Schatz, Charles Harold Scott Jr., Rondo Wayne Smallwood Jr., Vangelis Denzel Washington, Timothy Scott Wright, and Donald Lee Zepp.
All right, couple people there I recognize, Charlie Scott, which is a wonderful gentleman who was in the school system for years, and always enjoyed being around Charlie. He was always high-spirited. And Mr. Zepp, he spent a lot of his time on helping the school board build all the schools, and he was works for the school for a long time.
I did not know him.
Help out, yeah.
Well, the other thing about him is that he was the first Sam that was put for the Dallas Cowboys. It was the gentleman.
Is that right? I
Yes.
didn't know.
Wow.
Yeah. All right, need a motion to approve the 43 account for the month of July.
Second.
Motion been made, seconded. Any discussion? If not, all in favor say aye. Anyone opposed? The motion carries.
Thank you. And I have no hearings or other matters today.
That's even better news.
It
Keep
is.
up the great work.
You all have a nice week.
You too.
I did have to slip in this.
All right, Brian, you might as well come on back up.
Well, from our COVID-19 perspective, the big thing for us right now is we are in a vacation time, and we are in fact monitoring the hotspots throughout the United States as to where our people vacation. One of the big things being Myrtle Beach area.
On that behalf, are you having a Zoom meeting tonight?
No, we're gonna do it.
Okay.
We're gonna do it here, in person. But I mean, if you want to Zoom, we can hook something up here, put
No,
a meeting
no,
together real quick.
I won't be there tonight, but
Okay.
I thought maybe you want to be cautious a little bit.
Well, I think we'll be cautious with the mask, based on talking to the individuals, all but one. We're kind of out of the hotspot area, secluded in a, personal home, personal
Right,
beach.
right.
So I think the risk there would be low for those. Talking to the other board member, just hearing about how he presented himself while on vacation, I think we're going to be okay there as well.
Mm-hmm.
But it's something that's known so that anybody coming to the meeting can take the precautions they want to. We'll continue to social distance. As I was saying, we're monitoring these vacation areas. We're taking steps where we can to make sure that when our people come back, we've had one employee travel to vacation, came back, we kept them out 7 days, and then sent them for testing. Testing was done, came back negative before we put him back into the work rotation.
That was those 3 crews?
Now, those 3 crews that were quarantined are back. There was nothing came out of that, or what we call the self-monitoring phase. They're all back into work and doing what they're supposed to be doing. But as I said, we have the one gentleman that came back from vacation at Myrtle Beach, 7 days out, tested negative, got him back to work. We have one employee that takes her normal annual vacation there. You know, go ahead, take your vacation, but understand when you come back, I'm going to need you to telework from home for 14 days before I bring you in here and risk not only exposing our people, but folks that travel in and out of our building here. So we've been very fortunate. Most of our employees, nobody's tried to sneak behind us and go somewhere and not tell us. I think they've realized the impact that it could have on the citizens of the county and our team if, you know, they do that. So it's been pretty good. As far as our staff goes, we had a little complacency for a while. Everybody was thinking it was gone, it's gone, it's gone. And next thing you know, you're out, you're seeing people not wearing masks, you're doing the thing. So what we did is we said, okay, guys, we wanted you to do the right thing. Now we're going to tell you to do the right thing. So we put out a policy that, hey, every encounter in 95, we're going up. So let's get back into the routine of doing it again. So we reinforced that process. The other thing we've done is we just found out yesterday from one of the grant writers that the Ambulance Authority could in fact apply for some of this reimbursement. So started that process yesterday to build our application to go back and capture those months of March 1st through June in the hopes that maybe we can recover the close to almost between $800 and $1 million that could potentially be recovered.
And one of the things that we've talked about before is how the COVID-19 has actually reduced some of your revenue
It
on the transport side.
It did.
So tell us a little bit, has that changed? Is anything changing at the government level and because the other thing that we talked about was a lot of your field staff was treating on site.
Correct. What has changed there is there's been a multitude of changes as far as recovery and things that you can bill for. They've given you temporary codes that you can use to specifically bill for these things. As I have said, we did receive HHS stimulus money that is designated to offset some of those costs as well that we have to track. But we did have 1 month where we had dropped. I mean, our call volume was the same, over 900, but the patient transports were down 52%. So we don't get paid if we just go to your house in most cases. So that was a heavy month of losses there because you still continue, you upgrade your staff for things that are going on. But then
I'm sorry.
Go ahead. Go ahead.
But the transport side, that's pushing $2 million a year.
Transport side right now, as of the middle of this month, we've recovered about 2.53 million.
So, and when you go down to 60% of that, that's a huge drop.
Well, that's on, yes, exactly. If you lose a month of 52 to 60%, where you're averaging somewhere around 200,000 to 300,000 a month,
That's a huge cut.
it is. Well,
Because your cost doesn't go down.
yeah, your cost doesn't go down, doesn't change. So that was a pretty big hit, and it had, the good thing is we sustained it at the end of our budget year. So that was a good thing, but now we have to look at, now we've crossed that threshold, what are we going to run into? So
And it's not gonna go away for a while.
no, it's, I think depending on how bad it escalates is going to determine whether people stay home or not. Right now, we here in our local area aren't seeing that tasking level of people at our hospitals.
Right.
When I spoke to my contact at Berkeley Medical the other day, they only had 5 active cases in the hospital at that time, but that's been probably a week ago. And most of them were on the other side, or the downhill side of coming
So
through
they
that.
weren't on the fence.
No, they weren't. So that's always a positive thing.
And that's what I was telling somebody over the weekend, the whole intent when we done the local order was to make sure that we, on local, state, or federal level, was to make sure we didn't overrun our hospitals,
Correct.
right? And as I received an email from a gentleman, that said it seemed like we went from making sure we didn't overrun our hospitals to almost transition in trying to make sure that no one caught the COVID-19 virus. And he was true. That's kind of how it started to navigate through it. Well, we can't stop. We can slow up the spread. But until we get a vaccine, you're not going to stop the spread.
Correct.
It seems like everyone here locally has done a good job on trying to do that. And as you have your contact with Berkeley Medical, I have mine, and they're very happy.
Good.
Sad that we lost the lives that we did in Berkeley County, partially to COVID. Most of them already had preconditions, but it's you know, we don't want to lose any life that we can save, and I don't want to make sure the families understand that, but we much less than what everybody was expecting.
It is when you get in things like that. It's always hard when you have to implement risk management. But sometimes you have to accelerate where you go in order to back off a little bit as you come back. And I know people were upset. They feel the way they feel, but hopefully in time they're like, hey, that was probably the right way to go. We'll never convince them 100%, but we know what was right at the time.
Mm-hmm. I've heard very little complaints.
Yeah.
You know, other than some people do think that it went too far, and I can't, like you said, I can't agree or disagree with them.
Yeah,
We don't have that answer.
it's one of those cliffs. If you don't do enough, it's your fault. If you do too much, it's your fault. My thing is, you know what? I got big shoulders. Give it to me either way.
I think we're always used to that anyway, right?
Very much.
So, let's talk a little bit. One of the things I want to start doing is bringing you in on a quarterly basis. And we talk about the roadmap at the ambulance authority meetings. We don't need to talk about it today because it's not on the agenda, but you're going to be called forth and start giving us a presentation of your vision of the ambulance authority and the direction it's going to go. And you know, I keep bringing up to the county councils, you know, your field staff being tasked. You know, we're growing. You know, your crews are going to have to expand before long. I think your board has been a very, very good board. Gotten a lot of things accomplished in the last 7 years. It's been on the agenda for 15 years.
Yeah.
And currently you're financially stable. But at the same time, the one thing that the COVID-19 is going to do, and I just heard about it the other day, actually this morning from Mr. Bentley. There's a lot of people that, and I heard it over the weekend as well, a lot of people in the heavily populated areas that's going to look to go somewhere else. And the first stop they're going to be looking at is Eastern Panhandle, West Virginia. And so the growth, doesn't matter what we do or how it happens, people's going to be coming. So, and the economic outlook has already said that Berkeley County is going to be the heaviest populated county in the state of West Virginia, probably about 2025.
Yeah, as we look around the county and see the growth that we see with, you know, COVID, my wife and I on a regular basis, some weeks we're going to go to a new home, so we drive around and look at homes, and next week, no, we're staying where we're at. That's what I call that military mentality. You're used to moving on a regular basis, but we see the growth. My staff and I and others sit down and talk about what we foresee. We're very much aware of it. The one key sticking point for us, is not get too deep into it, is personnel. We are working in a business that our paramedics are being recruited to be nurses. The pay and the indoor stuff, out of the rain, out of the weather, is always pleasing. Right now, we're stifled by this virus because we have folks just standing in the door waiting to test, and these testing facilities aren't opening, and it just keeps getting pushed and pushed. So that's kind of put something on us. So to make it very simple, is you and that board of directors can give us $1 million worth of equipment. If I can't put that 10-cent butt in the seat of an ambulance, it does us no good. So we are working hard. How do we create our own programs for training and testing. What do we need to do as an organization to come about 99% self-sufficient? And we are, we've taught paramedic courses. We're currently teaching an EMT course that's sanctioned through other bodies. But I think going down the road, we'll have to make an investment in that education and becoming our own training institute so that we can take it from beginning to fruition. So that's just a long-term pie in the sky thing that we're looking at.
I think your board has done the same thing as the county council has done here, is trying to get the pay up to where it was. 'Cause
Oh,
the
yeah.
recession hurt all of us, right?
Very much.
And I think we've caught up.
Mhm.
Now we just gotta keep up,
And I think we're doing that.
right? And I think the last, I don't know about the recent recruitment, but the one before that, you had a great turnout and was very happy, I think, the chief said.
We just took on 5 new part-timers, and we are interviewing 5 paramedics Tuesday, Wednesday, and next week to start off 2 full-time positions. We've had 2 people resign to go other places due to they say scheduling for their families and things like that. But so it is a destination place for people to come. It's just a matter of keeping that growth moving so that we're not behind.
You're a little bit like Chief Goke and I just walked in the room. On the fire side, the public safety side is a little different than other occupations because, of crews working 24-hour shifts. Now, Chief Goke and I has 12-hour shifts. But it's very easy for your staff working 24-hour shifts to go east and work 2 days and come home and have 5 days.
Sure.
Right, so that makes it more easier to travel outside your area.
Correct.
Rather than traveling 5 days, you're traveling once,
Correct.
right, going back and forth. So one of the things that we've always talked about, if we're losing people to the east, maybe we need to do a better job recruiting from the west.
Well, we've gone national with our recruitment efforts through Indeed.com and online stuff. We've improved how people reach out to us. This time when we recruited for office positions, I said, hey, email, if you're interested, email me. I will send you the packet. That way I can track. Here's the packets going out. Here's the packets coming back to fill these positions. As you said, we are looking to other places. Not actively trying to poach people from the local area because we depend on them, but looking further out of those places. Compensations are very good around here, but you're never going to compete with a DC or Loudoun.
I mean, Loudoun County's the richest county in the state.
Yeah, you're not. That's not realistic to think that. But one thing we can do is look at, okay, is our scheduling system that we're using creating a burden on our providers to where we need to back off? And if that means that, how do we invest? Maybe we need to invest in a few more crews and then change that work schedule. And then, how do we go about doing that? Right now, we do have a multitude of 12 and 24-hour schedules out there. So we are looking at that. It's constant. It's dynamic. It's something that's going to continue to change, and we'll keep plugging along at it.
Yeah. All right.
Okay.
Thank you, sir.
Thank you.
Chief Coconair, you want to give an update on the COVID-19? That's where we're at right now. We're way ahead of schedule. Give it from the EOC and Homeland Security and all that stuff.
Good morning.
Good morning,
Hey,
sir.
Thank you. We're stacking up.
You don't look like you're any older than you did 30 years ago. You look at Jim and I.
Don't judge a book by the cover.
I don't know. This
They
book,
got hit with the white paintbrush, didn't they?
the binding's starting to give away on this book. I tell you.
I understand. Actually, this week we received a considerably large shipment of protective equipment from the state that we'll be dispersing next week. We've got it inventoried, and we'll be going out, really to the healthcare providers. I think that they've dropped off from like the dentists and the medical doctors, and the daycares, and those kind of places. So basically, taking the state just wants to maintain and try to take care of the healthcare providers. Berkeley Medical, Shenandoah Health.
So they're all they're well taken care of now.
Yes, sir. Yes, sir. I'm not aware of any needs that they have, which is, a welcome change. So, and the other thing that I'd like to report on is, we have participated in several of the drive-through testing
Right.
sites, help really with logistics and help get them set up. And that went very, very well. There's a great partnership between a lot of different agencies to have a successful testing site. It's my understanding that we may have another test site coming up in the near future, but we've not heard a whole lot about that. But they are wanting to continue to do some testing. In the last couple of weeks, we've been able to push out a lot of masks, the cloth mask that Haynes Corporation donated to the state of West Virginia. So we actually received 22,000 masks, and I think right now we have about 1,000 left. So, we just, anytime that any of us are going out into the public, we'll take a box with us and just say, hey, does anybody want or need a mask? Get them going. That's what the state wants, is to get these masks out there. So that's what we've been doing.
Good.
Long,
Kels?
The Haynes Company, I don't know if you knew this or not, owned a couple hundred acres of property in South Berkeley
Up on
County.
Spec Run Road. I was getting ready to say, I don't know whether it's Haynes or Hines.
Haynes,
Okay,
I think it was Haynes.
all right. Yeah, they back on Spec Run Road.
didn't know that.
Yeah, back at Ternaryville.
I know where it's at. I wonder if that was because of the mills back in the day.
It could have been, Haynes Chap. Back in that area.
It's all the way back, it's on the end of Spec Run Road, I believe. Yeah. So tell us a little bit about the partnership we've had with the local businesses that need to be recognized. We need to get some letters out.
Well, actually, I hope I don't miss any, but P&G has been a tremendous partner. Echo Lab has been a great partner. Early on we had some very demanding needs to try and take care of the homeless population, where they wanted to do a lot of carry-out meals, so that they weren't bringing folks in at the tables. So McDonald's, the local McDonald's corporation, Chick-fil-A, Johnny's, all these places kicked in to help being able to get enough stuff to be able to do the takeout meals, for the folks coming in. But it is truly, it's truly been a great partnership with, and I know I've missed some,
Right.
but when we had a need, some Argos Quarry was another a big help with some Tyvek suits that we did not have, and we were able to make a connection out there, and they came through. So, when we kind of networked, with our different partners and stuff, the people that had things that they felt that they could spare, they stepped up to the plate and helped us out. So,
Is it true, or in my memory, okay, kind of got a little bit to do with that birthday stuff, didn't even Eco Lab and P&G Forum do things together?
well, we had hoped so. We had actually tried to encourage that. We tried to.
They were trying to.
Yeah,
Yeah.
and then you get into the
Right.
honestly the government, because of the regulations
Right.
of having to go through all the steps
Right.
to get your patents and get the approvals through whichever different agencies that they fall under, and I think that they kind of said, look,
They couldn't do it because of the restrictions, but they were willing to do it.
they were, and it was I was excited about it because I thought, look, we've got this guy's got this, these people have this, all we got to do is bring them together,
Right.
and like, what can we do with the Swiffer product from P&G,
P&G.
and then what can we do with the sanitizing that Echo Lab has, so we did connect the dots on our side to try and bring them together, but it never came
Now,
through.
when you say our side, you mean the EOC had a lot to do with this, right?
Well, I don't know how much we had to do with it other than the idea.
But organizing a lot of
Yes,
stuff too,
we
right?
we brought people together.
I mean, things on the, good running machines need to be oiled. They have to be oiled for the testing to go smoothly, and pull all those agencies together.
It does, and it's, you know, those relationships, like with Ecolab, and a lot of other places, they're not new. Those relationships that we fostered over a long period of time. You know, the P&G relationship, that's relatively new. You know, but they're great. I mean, the contacts that we have there, you know, they'll bend over backwards to help you, and that's pretty good. You know, so when we're able to, you know, come up with an idea that may help the general public as a whole, and say, look, these guys have this, these guys have that. Let's see if we can get them together. You know, and they were willing. They were kind of excited about it as well, but it kind of ran out of gas. You know, so maybe somewhere in the future, you know, that opportunity may, you know, come back. But but it does. I mean, it just takes people willing to listen and cooperate and say, hey, I think I can help here.
Yeah, we had some other companies that are here and plan on locating here that was willing to try to do something, and like you said, it just, you know, it fizzled out, but it wasn't no fault of theirs.
Yeah. And, you know, and another thing was, throughout this whole process, you know, we didn't have any agency that wanted it all, you know, and we were going to make sure that our folks, our medical people and fire departments, they were taken care of. But at the same time, just because, you know, Berkeley Medical is the largest facility here, they didn't come in there and say, we want it all. You know, they were willing to share, you know, to make sure that everybody got stuff that they needed. And once again, that's what it takes, you know, to try and help everybody.
Yeah, I think you all, everybody involved, done a wonderful job, because I mean, when we gave away supplies, you distributed supplies, people were very grateful for what they got.
They were.
You know?
And, you know, you all made a tremendous investment, which came at the absolute right time.
Early on.
Early on. And that helped all of us. I can tell you personally, it lowered my stress levels, because I didn't have stuff. I didn't have enough stuff, and I worried about that. I worried about it night and day.
Well, the timing on that purchase was perfect for the council and our community, because we called it before most people even tried to make those large orders.
Yes.
Shortly after that, and that was to the thanks of Mr. Bentley.
I don't think that anybody.
I mean, Tracy had stuff ordered, and all of a sudden the state bought all 100,000.
Right.
Kind of pushed us right out of the scene, but
I don't know. It was difficult to look at the long term, because nobody had experienced this and didn't really know exactly what all we were getting into. But you know, I think that we did very well locally. I do, and like I say, the first couple of weeks were a little bit challenging to make sure that our EMS crews in particular had the stuff that they needed. The fire departments would go out to assist, make sure they had the things to need to protect themselves. You know, not just, you know, for themselves, but to be able to not have to take this home to their families. You know, so we were scrambling, trying to find the stuff that we needed, and but it all worked out fairly well. And you know, we're still supporting agencies. You know, we still have hand sanitizer, we still got some cleaning supplies, and as people need it, you know, all they do is call, and we'll get it to them somehow.
I think for you and your staff and anybody on the public safety side, you know, we, even at our age, we still think we're invincible. We're going to go in and do what we have to do, because that's how we're wired. Unfortunately, we got to be smart enough to think about what we're taking home to our family.
Yes.
And that was the scary part for anybody on the public safety side, or anybody that had to go out, was, you know, we'll be okay. What about, you know, our wife and children? And at your age, it'd be grandchildren.
That's right.
At my age and everybody else up here.
Great.
Right? And that's what makes you think. I mean, we do a lot of things out here and take care of a lot of issues and problems if we didn't have family.
That's right. But it's when you stop and think about, the impact of this community, the healthcare workers, the nursing home workers, police, fire, EMS, law enforcement,
Truckers, every,
grocery store workers. Nobody called off sick. Nobody took a vacation. They came to work. They served the public. They did their job. And
court security.
court security, it just, everybody came to work and did what they needed to do. Nobody ran. Everybody stood fast and did their job.
And I'd like to say that about the county council staff. The county council staff that we have here in Berkeley County, they had the option to work a week, take off a week, just like everybody else, and they chose to work.
Yeah.
And wanted to work.
Sure.
So, it's proud to work with a bunch of good people
That's right.
that want to do their job.
They're dedicated employees.
Yes, sir. All right. Thank you, sir.
Yes, sir. Thank you.
Anybody have any questions or statement for Eddie? I should ask that. All right.
I'm just glad that we are where we are.
Yep.
That's,
I think so. I was talking with a family member of one of the people that passed from the virus this weekend on Saturday and Sunday, and going okay. I think I've covered everything other than Mr. Barn, public, any items from the public. There's no public here, so if I'm correct, I'm saying, Mr. Barnhart, would you want to do the honors?
Mr. President, I'm glad to make a motion to recess.
All right, we are recessed.